Greetings and welcome to another lecture in psychopathology. Today we're going to start out, or in this lecture anyway, we're going to start out by talking about which therapeutic approaches should be used. So, in other words, there's a lot of different ways that psychotherapy and psychological therapy can be done. We're going to be covering them in very brief in this chapter. So which one should be used? Generally, there has been a large focus these past 20, 30 years toward what's known as evidence-based theories. Now, this sounds kind of silly in that, of course we're going to pick things that have evidence that they work. But in actuality, in the long history of psychology, there has been a lot of using stuff that don't necessarily work. But people think they work or that they should work, and so they get used. So this is actually kind of a big switcheroo here to try to work on things where we can actually demonstrate their efficacy through double-blind, randomized clinical trials in order to make sure that this is actually happening and it's not, wishful thinking that you see a difference, and it's not, that we don't have the different types of observer error, experimenter error, or any other type of error that we could have creeping in there. The downside of this, and what you might want to go, just a little bit, is that very often these clinical trials, particularly for medication, are kind of expensive, and they're also funded by pharmaceutical companies. And so we need to make very, very sure that the people who are funding it have skin in the game, as it were. They have an incentive to make sure to show that this works, because if it works, they're going to make money off of it. If it doesn't work, they're not. So a lot of times these clinical trials really need to be backed up by perhaps more objective people running the experiments. So even with things like these randomized clinical trials, it's still possible to have them not exactly be accurate, not exactly be reflecting reality. Psychotherapy is a lot harder to test than medication. Medication is easy. You make a real pill, you make a fake pill, everybody gets a pill. It's a lot more difficult to find a good placebo for psychotherapy where someone sits and talks with you. Simply because people know what psychotherapy is and they know when they don't receive it. And the fact that it's difficult to find a good placebo for this makes it more difficult to test the evidence, basis for psychotherapy. What tends to be done sometimes is what's called manualized therapy. And this is essentially where, you read the manual. There's a manual on how to do the therapy, exactly how to do it, exactly what to say, exactly when to say it, so that it's standardized. Because that's the other problem with psychotherapy, is it's hard to standardize something that is so, in some ways, improvisational. And so everybody sticks to the script, everybody does the same thing, and that way you can alter the script. And, or you can, in some ways, so it's not exactly the same, and then the researchers can look and see if there is indeed a difference. It's possible, it's just harder. So which should be used? Should we go with medication, or should we go with the various types of psychotherapy? And the answer to that is it depends, which I know will come as a huge shock to you at this point. One thing to point out is that although recently it seems like therapy has really been swinging over to the medicine end of the spectrum, medications used to treat psychological disorders do not fix any underlying problem. They're very much like, as I believe I mentioned before, they're very much like taking a pain reliever when you sprain your ankle. If you sprain your ankle and you take an Advil or a Tylenol or acetaminophen or ibuprofen or whatever, aspirin, and you take it and your ankle doesn't hurt anymore, it doesn't mean your ankle is healed. It simply means that you're masking the symptom of pain. And that indeed is what works here. When people take medications to treat their psychological disorders, whatever that's underlying, that's triggering the disorder is still there, whether it's biological or psychological. That's not being fixed with medication. You're masking the symptoms. And so, in a lot of cases, it might not be a bad idea to use both. to use both medication and psychotherapy. To use medication perhaps to relieve the symptoms enough so that the person is willing and able to undergo psychotherapy in order to maybe fix the underlying cause whenever possible. In fact, for something like depression, this is, it should be anyway, standard. This is one of the problems with going to your general practitioner for treatment of depression, is they really don't know anything about psychotherapy, about talk therapy. And if a person doesn't want to go to a psychologist, then all you're going to do is treat the symptoms. When in fact, with depression, if you treat the symptoms and then go in for psychotherapy, you very often can treat the whole thing, for many people anyway. There are some exceptions to this. And one exception is anxiety. Probably because a lot of anxiety is not necessarily psychological. It really does seem in a lot of cases to be our body, our fight or flight response kind of running away with us. Now, there are some types of anxiety disorders that are treated really, really well with psychotherapy. The phobias, obsessive compulsive disorder, that sort of thing, can really be treated well. But sort of a generalized anxiety, not so much. Panic disorder, not so much. Not for everybody anyway. So really, as always, depends on the person. It depends on the disorder. It depends on, exactly what is happening. So I'm going to start out by talking about starting out with some of the therapy, starting out with what are called the psychosocial approaches. And in this case, I'm using psychosocial approaches basically to mean behavior therapy. Now, this is not cognitive behavior therapy. This is behavior therapy. We're not worried about the cognitions. We're going to get them in the next one. Probably the next lecture, but at least a slide or two from now. This is fixing behaviors. Okay? If your behavior bothers you, fix it. That sort of thing. And so this tends to work really well for things like phobias. For instance, exposure therapy. Very, very good treatment for phobias. If you are afraid of dogs, for instance, there's a couple of ways that can be dealt with. It can be dealt with through systematic desensitization. These should hopefully sound familiar to you from prior classes, where we could set up a hierarchy of fear and work the way through maintaining relaxation until the person can basically be around dogs without being frightened at all. We can also do flooding, which is to, somehow restrain the person and surround them by extremely friendly dogs. Not mean ones, that'll just make it worse, until they're no longer afraid of these extremely friendly dogs. We can do that in vivo, which is in real life, which might mean literally, taping somebody to the floor and letting puppies play all over them, or it could be in some sort of virtual reality. Works the same. Works really well. Although systematic desensitization may take longer, it's also a lot less stressful. There's aversion therapy. Aversion therapy is sort of straddling the line between operant conditioning and classical, and that in some ways we're classically conditioning an association with something you don't want to do with something bad. So that when you think about doing that thing that you shouldn't do, like smoking, that it's associated with something bad which makes you not want to do it. It could also be punishment. In that, people for a while were wandering around with giant rubber bands on their wrists, and every time they wanted to have a cigarette, they'd snap that rubber band on their wrist and hurt themselves in the hope that therefore they would no longer be craving cigarettes. It didn't work, which unfortunately is true for a lot of aversion therapies. As it turns out, for aversion therapies to work, you really, really, really have to want them to work. And unfortunately, a lot of people don't necessarily really, really, really want them to work. And sometimes they can be very controversial. Punishment, for instance, has been used in some cases to try to get people with autism to stop hurting themselves. Few people with autism do their self-stimulating behavior, do their stimming by performing behaviors that could actually be damaging to themselves. Whether it's clawing themselves, slapping themselves, hitting their heads into the wall, punching themselves, pinching themselves. It can be dangerous. It can be damaging. And the idea is to try to punish them so they don't do it anymore. And the hell of it is that works. That for a lot of people with autism, I can't imagine that hitting your head into the wall doesn't hurt worse than getting a very, very mild, static shock. But If you give a person a very, very mild static shock, every time they start to hit their heads on the wall, they will stop hitting their heads on the wall. Almost always. This, of course, is controversial because it turns into, oh my God, we're shocking people, we're shocking kids with autism, and it has perhaps been abused in the past. And, it's something's controversial when they make a Law and Order episode about it, and there have been a couple. So, it can work in some cases when it's involving punishment, but it can be controversial, and if it's involving just classical conditioning, it doesn't necessarily work. Modeling. Showing people the behavior they should do and then having them imitate it. Whether it's showing children how to play nicely with others, or whether it's showing adults how to, go to a bar and meet people. Tends to work very well with children, tends to work again very well when people are willing to go through with it. Is that showing people the behavior, modeling the behavior, having people imitate the behavior can indeed help. Systematic reinforcement. Okay. Now, systematic reinforcement is a applied behavior analysis word. It's also known as contingency management. And myself, as a former animal trainer, basically, we called it shaping, which is you pick a behavior you want them to do and you reinforce behaviors that get closer and closer and closer to that final behavior. It's how you train an animal to jump through a hoop. You train it to approach the hoop. You train it to walk through the hoop. Then you just train it to keep going through the hoop as you raise the hoop higher and higher until eventually you could train an animal to jump through a hoop. I once got really bored and trained my aunt and uncle's cat to jump through a hoop because I had a whole bunch of treats and some spare time. It was easy to do. The cat was food motivated, and I taught it that it would jump a good foot off the ground to go through this hoop. We do the same thing with people. We pick a behavior we want them to do when we reinforce as they get closer and closer and closer to it. It's why, for instance, in kindergarten, when kids go and sit in their chairs, you praise them lavishly, and they still get praised a little bit as they go on. And by the time they hit middle or high school, they're expected to just go and sit in their chairs. You don't have to praise them, but they do it. So you do the same thing, basically, but this time with behaviors that are the opposite of those unwanted behaviors. It's far better to reward the opposite of a behavior than to punish a behavior. Because rewards are better than punishing, and if you're rewarding they're doing the opposite behavior to get rewarded, they can't do the behavior because they're doing its opposite. Token economies can work quite well. Token economies are essentially using money. Except money is a token economy. But in this case, it might be something else. It might be every time a child or someone does a behavior you want them to do, you give them like a piece of paper, or you give them a poker chip, or you give them something, and then they can take those pieces of paper, those poker chips, and swap them for something later that they want. It's essentially money. It's essentially paying people. It works quite nicely, except you need to be careful that you taper off the paying. The problem with reinforcing a behavior every time it happens is that when you stop reinforcing it, it goes away. So you need to make sure if you're doing this that you go into from continuous reinforcement to partial reinforcement until eventually you wind up not having to reinforce it at all. Behavior therapy is fantastic for certain things. If you have a specific behavior you want to stop or a specific behavior you want to get rid of, behavior therapies, including token economies, but all behavior therapies are fantastic. They work quickly, they work well, they can work permanently as long as you phase out the reinforcement properly. However, a lot of people don't have very specific behaviors they can point at. And these are more vague, these are more global, these are much less easily fixed. Okay? It's easy perhaps to train someone out of, a phobia or to train someone out of a self-injurious behavior than it is to train somebody for when they're having hallucinations or delusions and schizophrenia, or they're having tics that are involuntary, or so forth and so on. So, yes, and these are probably the treatments that work the best. But they only work for very, very specific problems. They don't work for everything.